Since you learned a lot about therapy, how do you kind of incorporate that into your sessions? Does it look like a normal therapy session alongside medication management, or?
Yeah, it's a good question and something I'm still kind of working out. So I think good medication management should incorporate therapeutic principles no matter what, and a lot of supportive therapy, but also things like, even if you're not doing like specific CBT, thinking through those principles or like what behavioral changes could help, what thoughts are leading up to this, more dynamic principles like what led up to this in your life of you being here, how do you conceptualize your problems, how are you relating to the medication, how are you relating to me. So I think it all like sometimes this distinction between like I'm only doing med management and I'm only doing therapy. I think people understand there's a lot of combination to both of those, but really utilizing that knowledge, taking that into account and kind of everything I'm doing in the session. Right now, I kind of have it as more of a medication management specific practice of what you might think of that, like 30-minute follow-ups, but I have a lot of flexibility where I can see people more regularly, which is really nice. And I'm just starting off, so I just started like earlier this week. And I'm hoping to get a little bit more of a mix of like specific therapy sessions, potentially look into getting a little bit more psychotherapy training while I'm here in Seattle. And then from there, maybe have a subset of patients who I would be open to doing medication management for, but also having like distinct psychotherapy sessions, if that makes sense, kind of like the more traditional frame, traditional timeline, traditional like type of work, and kind of more explicitly talking about that with patients.